Hello, this is Dr. David Greene, CEO of the California Pain Network. The topic today is an overview of sacroiliac joint pain. There are two sacroiliac joints in the body, otherwise known as the SI joints. They are located where the pelvic bones meet up with the sacrum. Okay? The SI joints contain cartilage, and they do see some slight movement of 2 to 4 millimeters. Nothing like what you see in a knee or a hip, right? Degeneration can occur just like in other joints because they do have a cartilage-bearing surface. Studies show that 12 to 25% of low back pain is coming from a problem in the SI joints. So it's much more than you might think, okay? It may lead to referred pain in low back, buttock, hip, or the leg. Treatments for SI joint pain consist of things like over-the-counter pain medications, anti-inflammatories, Tylenol to start. When it gets bad, narcotic medications may be very helpful. It is not a good idea to use them for chronic, long-term use for an SI joint problem, but when it flares up, it can be a very good idea. You can also use topical medications that can go over the area, and this goes, they call it transdermal, through the skin, and those can be great because they don't get into the bloodstream, and there's no drug interactions with things you're taking by mouth. Physical therapy and chiropractic treatment can be very helpful. TENS units, such as you see here, it's about the size of an iPod, and it has these foam pads that go over the area of pain. Slight electrical impulses go through that, and it can change the way the brain perceives pain signals. Additional modalities may include ultrasound, massage. Those can all be beneficial. Interventional treatments, if it's causing some spasms and some aching, then trigger point injections can be very helpful. They're just little superficial injections to help with that. SI joint injections, where you put a needle right into the SI joint, those can be extremely helpful. It's a little bit tricky because it's a jagged, irregular joint, so a pain doctor needs to be very skilled. You don't do this freehand. You do it under fluoroscopy, which is X-ray guidance. A lateral branch block consists of an injection around the joint to deaden the nerve endings that are supplying sensation to the joint. If that works well and then wears off, a radiofrequency ablation can provide anywhere from 6 to 18 months of pain relief. Radiofrequency ablation has been an amazing improvement in the treatment of SI joint related pain. Over 50% of patients achieve at least 6 months of considerable pain relief with a radiofrequency ablation. Here's what you're doing. These little nerve endings here, 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 they're supplying sensory supply to the joint. Okay? No motor, just sensory. A joint has to have a nerve supply to feel pain. So if you deaden that with thermal energy being applied and heat to this area, you can deaden the pain, okay? And these little nerve endings will grow back, but when they do, you can just repeat the procedure with the expectation of the same type of result. It's an outpatient procedure, it's low risk, it's increasing tremendously in popularity because of the studies like this, and also because it's done really, really well with back and neck pain as well. The top pain management clinics in California are affiliated with the California Pain Network. There's multiple clinics throughout the state. Over 50 insurances are accepted with over 25 treatment options provided. Overall, the average success rates for pain relief and avoiding surgery are over 90%, and the pain doctors are board certified and award winning. Visit us online today at californiapainnetwork.com, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the California Pain Network. Your pain stops here.